Hello everyone. So we will begin the MCQs, and the MCQs are, the first MCQ is, a woman comes to you for an antenatal checkup. 2 weeks past her EDD. So which of the following is not an etiological factor for her condition? It's an anencephaly, sedentary habit, primary parity, or it's a maternal stress. So I will just repeat the question. The question is basically it's an OBG question, and the question is, a woman comes to you with an antenatal checkup, that to 2 weeks after her EDD. And EDD, is the estimated date of delivery, that is EDD. So if a woman comes to you for an antenatal checkup 2 weeks after her EDD, which of the following is not an etiological factor for her condition? And the options here are anencephaly, sedentary habit, primary parity, or it's a maternal stress. So I can know the answer. You can just tell the answer. I'll just repeat for the last time. It's a woman who comes for an antenatal checkup, that too 2 weeks after the EDD, and which of the following is not an etiological factor for her condition? It's anencephaly, sedentary habit, primary parity, or it's a maternal stress. So if you know the answer, just tell that. Okay, the answer I will only tell. The answer is basically it's D, because whenever a mother has a stress, if a mother has a stress, it will lead to preterm labor. So whenever a mother has a stress, it will lead to preterm labor and not the postpartum labor that they have given. So what are the conditions in which the lady will have a post EDD? It will be a hereditary, primary parity, sedentary lifestyle, or there can be a elderly multipara, anencephaly can also be there. So next we have, it's match the following section of IPC, that is the Indian Penal Code. So basically you have to match the following. So I will only tell the answer here, because I cannot tell you to match without seeing it. So it's like 191 is for doctors only. So it's like 191 IPC. If it is a 191 IPC, it is giving false evidence, that we call as perjury. And if it's a 192 IPC, it's a fabricating false evidence. 196 is using evidence known to be false, and the last one is 197, which is issuing or signing a false certificate. So I'll just repeat very fast once again. It's a 191 giving false evidence, 192 fabricating false evidence, it's a 196 using evidence known to be false, and the last is 197 issuing or signing a false certificate. So next question we have, recommended dietary allowance is calculated by. If you have to tell the formula here, if you know the formula, you can just tell it. The question is, recommended dietary allowance is calculated by. Options are estimated average requirement plus 2 standard deviation. It's an estimated average requirement minus 2 standard deviation, or it's equal to the estimated average requirement, or the last option we have is 2 into estimated average requirement. So if you want to answer, you can. So anyone wants to answer what is the recommended dietary allowance? The formula basically I'm asking. So here the options are estimated average requirement plus 2 SG, or it's minus 2 SG, or it's equal to the estimated average requirement, and the last option was 2 into estimated average requirement. You have to know the formula, you can just tell that. So I will tell the formula here. It's a PSM question, and the formula for a dietary requirement, that is the recommended dietary allowance. So the formula is EAR, that is the estimated average requirement plus 2 standard deviation. So in that case you have to remember it. What is the RDA? What is the estimated RDA? It's plus 2 SG. Next we move on. Next question we have, it's a lymph node, that is a hematology question. The question is, the lymph node biopsy of a patient with lymphoma is given below. It shows 2 different cell populations labeled as A and B. Which of the following is false? I will just tell what is the image they have given. It's basically it's a case of a okay, just tell me in which case you will see a pathological image having a steric eye appearance. So if you can tell this, it's very good. If you can't, it's okay. So in which in which of the following in which pathological image you will have a steric eye appearance? Anyone wants to tell a diagnosis here? See, one request is there, but what will you do coming live? Okay, the question was, it's a steric eye appearance and of a Burkitt's lymphoma. I just told the answer only in that case. Okay, it's a case of a Burkitt's lymphoma, and there is a steric eye appearance in case of a pathological image. So basically you have to tell what is the image. So yeah, it's a steric eye appearance, what I told, and the reactive macrophages represent the stars in the steric eye appearance. On the other hand, the homogeneous tumor cells represent the sky. So you have to remember like that. Let's see, we have what is the most common reaction occurring in patient undergoing blood transfusion? Yeah, it's an easy one. What is the most common reaction occurring in patient undergoing blood transfusion? Options are febrile hemolytic, febrile non-hemolytic, it's a non-febrile hemolytic, or it's a acute hemolytic. So it's an easy one. Most common reaction occurring in patient undergoing blood transfusions: febrile hemolytic, febrile non-hemolytic, non-febrile hemolytic, or it's a hemolytic. So if you can answer that, it's an easy question. Anyone wants to answer that? It's an easy question. Most common blood transfusion reaction is febrile hemolytic, non-febrile hemolytic, febrile non-hemolytic, or it's a acute hemolytic. So I will only tell the answer. The answer is very easy. It's B. That is a febrile non-hemolytic is the most common blood transfusion reaction. So you know it's anaphylaxis reaction. Yeah. So you know all the blood transfusion reaction, what we need to do. It's first will be anaphylactic, then allergic and all that. Then febrile non-hemolytic. Then we have transfusion related, that is Trally. You know what is Trally? It's a transfusion related acute lung injury. And then we have acute hemolytic transfusion reaction and delayed hemolytic. Yeah, hemolytic, it's basically it's a febrile non-hemolytic. You have to remember it's a febrile non-hemolytic, which is the most common blood transfusion reaction. Hemolytic we have, but it's a later stage. So the most common is the febrile non-hemolytic. So yeah, you were right, febrile only, but it's a febrile non-hemolytic. Next we move on. A patient comes to you with the suspected Cushing syndrome and is found to have elevated ACTH values. So what is the investigation of choice in this condition? I will repeat, it's a patient who was suspected with Cushing syndrome and is found to have an elevated ACTH. What is the investigation of choice? Options are MRI brain, CRS stimulation test, high dose dexamethasone suppression test, or it's an inferior petrosal sinus sampling. Yeah, it's also easy question, but if you know what is the question, it's what is the investigation of choice for Cushing syndrome, they are just asking. And that too, if it's a elevated ACTH, I'll just repeat the option very fast. MRI brain, CRS stimulation test, it's a high dose dexamethasone suppression test, or it's an inferior petrosal sinus sampling. So yeah, anyone wants to answer? Okay, the answer is also, it's like a MRI brain. Yeah, MRI brain is the investigation of choice. In which condition? See, they have already given there is a elevated ACTH. So basically it's a ACTH dependent Cushing syndrome, and yeah, for a ACTH dependent Cushing syndrome, the investigation of choice is MRI brain. So yeah, and yeah, if the MRI brain shows a mass, it is suggestive of pituitary mass that to greater than 6 mm in size. And however, if the MRI brain doesn't show any mass, it suggests a pituitary tumor of less than 6 mm, or it's an ectopic ACTH source. So yeah. So yeah, there is one more. There is a high dose dexamethasone suppression test, which you all know, we use for Cushing syndrome, and CRS stimulation also. It is employed to differentiate between pituitary and from the ectopic ACTH. So yeah, we differentiate for that. But yeah, if it's a ACTH they have given, MRI brain is the investigation of choice. Next we move on. The interpleural pressure, that is in centimeter of H2O, at the beginning of inspiration is around, it's minus 3.4, minus 2.5, 0 or plus 2.5. Yeah, so anyone wants to answer this? If you know the answer, I'll just repeat the interpleural pressure, that too you have to tell in centimeter of H2O at the beginning of inspiration is minus 3.4, minus 2.5, 0 or plus 2.5. So yeah, if you can answer this. It's a factual question, but you have to remember. See, the normal interpleural pressure at the beginning of inspiration is about 3.4. So you have to remember it's minus 3.4 centimeter. The normal interpleural pressure at the beginning of inspiration. And when there is a peak, when it is in the normal inspiration, when it is a peak, it is minus 8.5 centimeter of H2O. So you have to remember, it's nothing to tell much. So next we have, it's a opthal question. Yeah. So the question is, a 34-year-old lady presents with the eye pain, photophobia and red eye. So the slit lamp examination finding is shown below. on which layer of the cornea are these present? So I'll just tell you what is the image which they have given below. It's a keratic precipitates. So I'll just repeat, it's a keratic precipitates which are the proteinaceous cellular deposit occurring at the back of it's the back of the cornea. So I'll just repeat the question. It's a 34-year-old lady who comes to you with eye pain, photophobia and red eye. Slit lamp examination shows the deposits which I told, that is a keratic precipitates is shown in the slit lamp examination, and on which layer of the cornea are this present. I already told the answer basically, but the options are epithelium, endothelium, stroma and Bowman's membrane. And I just told the answer, basically it's the back of the cornea, but basically it's the endothelium. So to remember, it's like a keratic precipitates are in the back of the cornea, that is that too in the endothelium, we have to remember in that way. So they are arranged in the triangular fashion, occupying the center of the inferior part of the cornea, that is the artless triangle. Next we move on. It's very easy. What is the incubation period of a yellow fever? It's 3 to 6 days, 3 to 4 weeks, 1 to 2 weeks or 8 to 10 days. So if you can tell. Hay fever, not yellow fever, it's not hay fever, it's a yellow fever. So what is the incubation period of yellow fever? 3 to 6 days, 3 to 4 weeks, 1 to 2 weeks or it's 8 to 10 weeks. So if you can answer it. I know no one wants, but okay. So the answer is really it's A, that is 3 to 6 days is the incubation period of yellow fever. So you have to remember all. It's like dengue, you have 5 to 8 days, then typhoid is 10 to 14. With typhoid it takes a lot of time. So typhoid is 10 to 14 days, dengue 5 to 8. Then the important ones, just I will tell, it's chickenpox, that is 13 to 17. Hepatitis A and all that is 15 to 40 days. So that's all. So it's a yellow fever, that is a 3 to 6 days. Next question we have, what is the transformer ratio of the middle ear? So it's an easy one. Yesterday, no, 2 days back only we discussed, I think. What is the transformer ratio of middle ear? That is the incus and that one. That is the ratio. It's 1.3:1, 14:1, 17:1, or it's 22:1. So what is the transformer ratio of the middle ear? 1.3:1, 14:1, 17:1, or it's 22:1. Anyone wants to answer? It's low impedance area to the high impedance oval window. So okay, what is the transforming action? I will just tell. The middle ear has to conduct sound waves from a low impedance tympanic membrane to a high impedance tympanic oval window. So this is done by matching their impedances. It is called transforming action. Because transformer ratio is basically it's an aerial ratio into level ratio. It's a 22:1. So I will just tell it's what is the transformer ratio of the middle ear. So the transformer ratio of the middle ear is 22:1. We have the aerial ratio into levator, that is a level ratio. So there is nothing to tell much. We have to remember this. It's a aerial ratio into level ratio, that is 1.3:1. Next we have a patient. We have a patient who requires ceftriaxone 180 mg. And you have a 2 ml syringe with 10 divisions per ml. So I know it's a boring one, but I have no choice. It's a patient with ceftriaxone 180 mg. You have a 2 ml syringe with 10 divisions per ml. The vial contains 500 mg per 5 ml of ceftriaxone. So how many divisions in the 2 ml syringe will you fit to give a 180 mg ceftriaxone? So basically it's a question of calculation. I will just repeat. If you don't want to answer, it's okay, but it's a calculation question. It comes in the exam, but we have to. I'll just repeat the question. A patient requires ceftriaxone 180 mg. You have 2 ml syringe, that to 10 divisions in that syringe. So the vial contains 500 mg per 5 ml of ceftriaxone. So how many divisions in the 2 ml syringe will you fit to give a 180 mg ceftriaxone? So I know you won't want to calculate, but I'll only just tell it. It's see they are asking for a it's like 500 mg of a drug is in 5 ml, and hence that is 100 mg in 1 ml. It's a simple calculation. Then 180 mg in 1.8 ml, so 10 division in each ml. So it's like 1 ml is equal to 10 divisions, and therefore 1.8 ml is equal to 18 divisions. So it's a calculative question. You have to just remember that. Moving on to the next question. Which of the following is the most common site for a fixed drug eruption? It's an easy one if you know. Which of the following is the most common site for a fixed drug eruption? It's a face, extremity, trunk, or glans penis. So yeah, if you know the answer, it's very good. So which of the following is the most common site for a fixed drug eruption? It's face, extremity, trunk, or glans penis. So if you know the answer, it's anyone wants to tell the answer? Fixed drug eruption. It can occur anywhere, but yeah, it occurs in the. Okay, if you don't want to answer, it's okay. So it's a D, right? The glans penis is the most common site for a fixed drug eruption. That too, we have 50% of the FDE occurs in the mucosal and the genital area, that is genital and the oral mucosa. So yeah, other common sites are palms and soles, and the drug which we have reported causing an FDI, it's a NSAIDs, tetracyclines. Then we have a sulfur-methoxazole, methimazole, carbocysteine. So you have to remember the drugs which basically cause FDE, that is the fixed drug eruption. I will just repeat, it's NSAIDs, tetracycline, methimazole, carbocysteine. So next we move on. It's a psychiatric question. Yeah, a schizophrenic patient is there and he rushed to the casualty after an attempted suicide. So which of the following drugs would benefit her the most? It's a quetiapine, olanzapine, risperidone, it's a clozapine. So yeah, if you know this answer, it's a better question. It's an easy question. So yeah, schizophrenic patient is rushed to the casualty after attempted suicide. So which of the following drugs would benefit her the most? It's a quetiapine, olanzapine, risperidone, it's a clozapine. Yeah, if you answer this, anyone at least then try, it's A, B, C, D. So yeah. So basically it's a case of schizophrenic patient, I already told you, and there is a attempted suicide, there is an increased risk of suicide. So yeah, the answer is very simple, it's a D, that is clozapine is the right answer here. It's the only drug among the atypical antipsychotics that has been approved for the use of schizophrenic patient who has a risk for suicide. So it's a clozapine. So next we move on to the next question. What is the Punnett square used for? If you know what it is, it's a Punnett square. And on the option, it's a PSM question, and the options are random sampling, finding genotype of offspring, population genetics, or it's a quantifying mutations. So yeah, if you can tell what is the Punnett square used for? It's a random sampling, finding genotype of offspring, population genetics, or it's a quantifying mutations. So yeah, it's really I've learned in before only. It's not a medicine. It's a medicine question, but yeah, I've learned it before only. Okay, I'll just tell. It's a Punnett square which we are talking about. It's in genetics, you know. It's a Punnett square. Really, it's for the finding of genotype of offspring. We use a Punnett square. So it's the probability of a particular genotype in an offspring, and it is used for a standard tool for genetic counselors. So it's a Punnett square. Next we move on. A 34-year-old man who comes to you with a discharging wound post-operatively. So culture reveals infection with MRSA. So which of the following cephalosporin can be used for this patient? So it's a cefepime, cefpyrone, ceftolozane, or it's a ceftaroline. I repeat, it's a question like 34-year-old man who comes to you with a discharging. It's a question like 34. It's a 34-year-old man who presents with discharging wound post-operatively. So you do a culture, and that culture you find basically it reveals there is an infection with MRSA. So which of the following cephalosporin can be used for this patient? And the options here are cefepime, cefpyrone, ceftolozane, or it's a ceftaroline. So yeah, you can just tell the answer here. So anyone want to tell the answer? It's what is the answer? It's basically, I'm just asking, it's what is the drug of choice for MRSA infection? So yeah, now you can just tell. It's a cefepime, cefpyrone, ceftazoline, or it's a ceftaroline. So yeah, it's a MRSA. Okay, I will just tell. It's a D, right? The ceftaroline that is the drug of choice for MRSA, and it is indicated for MRSA infection, and it's considered as anti-MRSA cephalosporin. We just tell that. So yeah, it's a 5th generation. So it's a MRSA, anti-MRSA, that is a ceftaroline. Next we move on. Next question, we have a patient who comes to the casualty after an RTA with the fracture of the femur. So the upper end of this fractured bone ossifies from how many ossification centers? It's an anatomic question. We just tell. Just repeat, a patient comes to you to the casualty after an RTA with a fracture of the femur. So the upper end of the fractured bone ossifies from how many ossification centers? It's 1, 2, 3 and 4. So if you can guess the answer, it will be fine only. It's 1, 2, 3 and 4. Okay, I will only tell its answer is 3. That is the upper end of the femur. You have to remember that it's the upper end of the femur. It ossifies with the 3 ossification center. Ossifies from the 3 ossification centers, and you all know that that's a factual one. So next we move on. It's a question like, it's a 5-year-old child with a Wilson's disease and he is being considered for a liver transplantation. So which of the following is not a parameter in the selective criteria for transplantation? So I will repeat, it's a 5-year-old child with a Wilson's disease and he is being considered for a liver transplantation. So which of the following is not a parameter for selection criteria for the liver transplantation? The options here are age less than 10 years, PT, that is prothrombin 10 greater than 100 seconds, bilirubin greater than 300 and jaundice less than 7 days before development of encephalopathy. So yeah, it's basically you have to tell the selection criteria for a liver transplantation. I'll just repeat the option. Is age less than 10 years, PT greater than 100, bilirubin greater than 300, it's like a jaundice less than 7 days before development of encephalopathy. So yeah, if you can just tell. There is a criteria, right? The criteria name is Kinch-Collis criteria. It's a Kinch-Collis criteria for liver transplantation. So you have to remember this. It's like which is for not a parameter. So the parameter is like that. It's suppose age is less than 10 years. So it's he is qualified for a liver transplantation. So yeah, I will just tell. Okay, if it is age less than 10 years, if PT greater than 100 seconds and if it is bilirubin greater than 300, you can consider him for a liver transplantation. But there is one contraindication, that is jaundice less than 7 days before the development of encephalopathy. So you cannot do a liver transplantation in that case. Next question we move on. It's what are the diseases caused by a single gene mutation referred to? I'll just repeat, what are the diseases caused by a single gene mutations referred to? It's a complex multigenic disorder, Mendelian disorder, structural chromosomal disorder, or it's a numerical chromosomal disorder. So yeah, what are the diseases caused by a single gene mutation? It's a complex multigenic disorder, Mendelian disorder, structural chromosomal disorder, or it's a numerical chromosomal disorder. So yeah, if you can just guess it out. Guesswork will also work in this case. Anyone wants to answer? Okay, I will just tell it. The answer is B. It's a Mendelian disorder. Whenever there is a single gene mutation, see, they have classified like single gene mutation, chromosomal disorders, and there is a complex multigenic disorder. So if it's that is a single gene mutation, it refers to a Mendelian disorders. They usually follow the classic Mendelian pattern of inheritance, that is single gene mutation. And then we have chromosomal disorders. In chromosomal, we all know it's autosomal X-linked disorders and all that. And yeah, so the question was, it's a Mendelian disorder, that is a single gene mutation. We move on to the next question. Next we have, it's like which of the following statements are true with respect to a WHO baby friendly hospital initiative for a small, sick and a preterm newborns? And the options here are, options are very big. Okay, I'll just tell the options. Option A is, that is a Paradise feeding is indicated in very preterm infants with no such swallow-breath coordination. Finger feeding is optimally indicated for short-term use and may improve breastfeeding rates for discharge. I know if I tell the options, everyone will go. Okay, so feeding tubes are indicated only in neurological compromised infants for long-term use, or it's a bottle feeding can lead to overfeeding but has a reduced risk of aspiration in infants with immature suck swallow breath reflex. So I know it's okay, I'll just tell the answer here. So the question was, which of the following statements are true with respect to WHO baby friendly hospital initiative for a small, sick and preterm newborn? And the right answer is B. That is, finger feeding is optimally indicated for a short term use and may improve breastfeeding rates at discharge, not before, it's at discharge only. So yeah, I'll just tell what they have told. Yeah, finger feeding I told already. Finger feeding, it is optimally indicated for the short term use and may improve breastfeeding rates at discharge, it is indicated in neurologically compromised and preterm infants. For short term period, you can do a finger feeding. Then what I was talking about, it was a puller type feeding. So puller type feeding is basically what it is indicated in preterm, late preterm, and it's a term infants. This is for supplementation. So it's, if it is a puller type feeding, it is for supplementation. You have to remember that. So yeah. Then next we have feeding tube. Feeding tube we all know, we use in ICU and NICU already. We use a feeding tubes. It's a orogastric or nasogastric tube, and which are very efficient for measuring intake, and it is optimally used for preterm infants with no suck, swallow, breath coordination for long term use. Then the last one was bottle and thread feeding, which is not recommended. Though not recommended, is an efficient way to feed, but it is not recommended. It's a slow flow threads mimics breastfeeding and are preferred to rapid flow. This is to give a slow flow feeds. So I just told, it's let's we move on. Which of the following inhaled anesthetics is the induction agent of choice in a patient planned for a surgery under GA? Yeah, it's, I think you can tell this. Options are halothane, cefafluran, desfluran, or it's nitrous oxide. So I'll just repeat, which of the following inhaled anesthetics is the induction agent of choice in a patient planned for surgery under GA, that is general anesthesia? Halothane, cefafluran, desfluran, or it's a nitrous oxide. So yeah, if you can tell, anyone wants to tell this answer, it's not an induction of choice also, but yeah, it's also a preferred one. So yeah, okay, I'll just tell the answer. The answer is B. Cefafluran is the induction agent of choice, and it's an inhaled anesthetic, and it's the induction agent of choice for a general anesthesia, for a surgery under general anesthesia. So yeah, it's an induction agent of choice among inhalational anesthetic, and it's a non-pungent, low blood gas solubility. So I'll just tell what are the disadvantages for other anesthetic also. See, like they have been halothane. So halothane, the problem is because it has a high blood gas solubility. So whenever there is a high blood gas solubility, it means it will move off directly. It will not stay in the body. So yeah, which will lead to a slower induction. There will be a slower induction also in that case. And C, desfluran and isofluran are basically airway irritant, of which desfluran is the most pungent inhalational agent, so can be given, and it causes laryngospasm. And the last was N2O, nitrous oxide, also you cannot give because MSC value of 104%, which makes it the least potent. So it is the least potent. See, nitrous oxide is the least potent, so can't be given. Desfluran, the problem is it causes bronchospasm and it's the most pungent smell, so you cannot give. And halothane, there is a high blood gas solubility, so you cannot give, because if there is a high blood gas solubility, the induction will be very slow, leading to a slower induction of anesthesia. So see, blood gas solubility, there is an inversely proportional relationship between the blood gas solubility and induction of anesthesia. And cefafluran is the induction of choice among the inhalational agent, and it is also non-pungent, and also it is low blood gas solubility. Let's move on. It's a 19-year-old boy. So a 19-year-old boy comes to you with a single painless papule on his penis with no enlarged lymph nodes. So a smear was made from the lesion and stained with white Giemsa stain, which showed the following as shown in the following picture. So identify the organism. See, we have done, I think we have done yesterday, not yesterday, whenever we have done, but yeah. Correct trends in EMS. What is EMS? EMS? Emergency medicine. Emergency EMS, I don't know. Okay, whatever. Just tell me what it is. I will just tell you what. Okay, I will just tell you about a patient who is a 19-year-old boy who comes with a single painless papule on his penis with no enlarged lymph nodes. So a smear was made from the lesion, and there is a which stained with right Giemsa stain. We are staining that, and the finding, it's a Donovan bodies. So yeah, it's a very easy. If I tell you Donovan bodies, just think of what. Just tell me the answer. Yeah. So what is a Donovan bodies? So I was just telling Donovan bodies. So it's a diagnosis, you can just tell from a Donovan body only. So see, Donovan bodies, it will be Donovonesis. It's very simple. If you have Donovan bodies in the peripheral space, it's a Donovonesis. But yeah, you have to tell what is the most common organism causing that. So the options are Treponema pallidum, herpes simplex, chlamydia trachomatis, or Klebsiella gynomatis. So I will just repeat for the last time. It's a 19-year-old who presents with the single painless papule on his penis with no enlarged lymph nodes, and on Giemsa stain you see a Donovan bodies that goes to a diagnosis of Donovonesis. So which is the organism causing donovonesis? It's very simple. I'm just moving here and there. So Treponema pallidum, herpes simplex, chlamydia trachomatis, which are Klebsiella granulomatis. So yeah. See, explain, emergency medicine services, current trends in EMS and all that, explain how to insert rice tube. See, I'm basically discussing the MCQs and cannot go in that way, just like that. And for insertion of rice tube, there should be a demonstration. Without demonstration, you won't know how to put a rice tube. It is different for both. It's for children and adult. We have a different. Yeah. So where I was in the I was in donovonesis only. I'm just going here and there again. Okay, it's a donovonesis. It's a case of a donovonesis and identify the organism. Organism is Klebsiella granulomatosis. See, one more Chanakya M sent a request. What you will do in coming live? Just tell me that. I will just allow you for the live if you want. So yeah, where I was, it was a Klebsiella granulomatosis. It shows the bipolar condensation of chromatin, giving a safety pin appearance. So yeah, it gives a safety pin appearance, and it's a Klebsiella granulomatosis which causes donovonesis. Next question, we have last 3 questions I think. An elderly man presented with a new onset pulsatile swelling over his breast as shown in the image. So he was recently discharged after a 1 month long ICU admission for urosepsis. So on examination, systolic bruit was audible and a Doppler revealed bidirectional flow of blood. Which of the following is false regarding a given condition? So just tell me what your diagnosis is. Without that you won't be able to tell. I'll just repeat the clinical scenario. It's an elderly man who comes to you with a new onset pulsatile swelling over the breast. They have given an image also. There is a little swelling at the breast. So it's a new onset pulsatile swelling over the breast, and he was recently discharged after a 1 month long ICU admission for urosepsis. So remember, it's a urosepsis, and on the examination systolic bruit was audible and a Doppler revealed there is a bidirectional flow is there. So what is your diagnosis? Just tell me the diagnosis. And basically the question is which of the following is false regarding a given condition. But yeah, if you don't know the diagnosis, you won't be able to tell. So in 1 second or 2 seconds to give a diagnosis, I will tell the question. Okay, you don't want. So it's a case of a pseudo-aneurysm. Now just use your brain. It's a case of pseudo-aneurysm. So which of the following is false regarding the pseudo-aneurysm? Options are: first, due to a focal dilatation in a vessel in which only the intimal layer is disrupted. Second option, treatment includes endovascular stent insertion and thrombin therapy. Third is the most common cause is iatrogenic, and the fourth, yin-yang sign is seen on Doppler ultrasound of this swelling. So it's a case of a pseudo-aneurysm which I am discussing, and you have to tell which of the following is false. So I'll just repeat the question. I'll just repeat the option. It's due to focal dilatation in a vessel in which only the intimal layer is disrupted. Second, treatment includes endovascular stent insertion and thrombin therapy. Most common cause iatrogenic, and yin-yang sign is seen in Doppler ultrasound of the swelling. So just tell me the answer which of the following is false. Okay, I will tell it's okay. A is the wrong answer, that is it's the false. The A option was due to the focal dilatation in a vessel in which only intimal layer is disrupted. See, you have to remember, in case of a pseudo-aneurysm, which is a pulsatile, I have already told all that. But in the case of a pseudo-aneurysm, it's not the intimal layer. Its intimal layer is there, but it is intimal and medial. So both the layers are disrupted. It's an intimal and medial layer are disrupted, causing the pseudo-aneurysm. So yeah, treatment, there will be a stent. You have to put a stent, and thrombin therapy you will give. And most common cause is iatrogenic, as they are also given in the case scenario also, because of urosepsis he was and all that. And yin-yang sign is seen in Doppler ultrasound of the swelling. So yeah, it's a yin-yang sign. It's not from India I think, but yeah. So yeah, it's a Doppler ultrasound reveals bidirectional flow and is known as yin-yang sign. Next we move on. It's which of the following emergency contraceptive is used in India? There is a misoprostol 400 mcg microgram, ethynol estradiol 600 microgram, that is a ulipristal 30 mg, or it's a Levano norgestel 1.5 mg. So yeah, if you can just tell the answer, which of the following emergency contraceptive is used in India? Misoprostol 400 microgram, ethinyl estradiol 600 microgram, ulipristal 30 mg, or it's a levonorgestrel 1.5 mg. So yeah, that is only the, yeah, if you can just tell, you have seen in the TV also, you have seen Aerodise come. It's an emergency contraceptive. Yeah, you know, I know you know the brand name, but yeah, content of the brand name is D, that is 11-orgestrel is the right answer. 11-orgestrel is 1.5 mg is the emergency contraceptive which we use in India. So yeah. And what about it? It is a single dose, can be used for emergency contraceptive, and which we have seen within 72 hours, they will do in the Aerodise. But yeah, it's basically within the first few days after unprotected sexual intercourse to prevent the unwanted pregnancy. Next we move on. That is the right answer. Levonorgestrel is the right answer. Postmenopausal woman comes to you with a history of pain. A postmenopausal woman presents with a history of pain over the wrist after falling down the stairs. So X-ray is done as given below. What is the diagnosis? Yeah, this is yin yang sign. I know it is yin yang sign, but which country I was telling that? No, don't go with that now. But yeah, its connection was paused. Okay, I was telling postmenopausal woman presents with a history of pain over the wrist after falling down from the stairs, and the X-ray is there. So it's easy. I'll just tell that will tell the answer. So it's usually X-ray is the articular fracture, distal end of radius with a dorsal angulation of the distal fragment. See, just tell me the most common distal end of radius fracture, and the answer is that only. So yeah, I will just repeat it. Suppose leave that all that. Just tell me what is the distal end of radius fracture, most common distal end of radius fracture, and that too it is a dorsal angulation, and it's a articular fracture. So yeah, if you want to tell, displacement is lateral displacement. Displacements are dorsal tilt, lateral tilt, supination, and impaction of fragments. At least now, okay, I will tell. It's a Colles fracture. Colles fracture is the most common distal end of radius fracture. Okay, and it's like a displacement are basically it's a dorsal tilt, lateral tilt, supination, and impaction. So yeah, there is a reason for deformity in Colles fracture, we should know. And what you will do, treatment is Colles cast in this condition. Next we move on. It's the last question for today. We have is a 2-year-old girl was referred for evaluation of recurrent urinary tract infection (UTI). She suffered 4 episodes over the past 9 months. Yeah, Colles fracture was the right answer for that. I know there is some delay in what I am speaking and what you are answering. There is some delay of some seconds or time, but yeah. So yeah, I was telling is 2-year-old girl was referred for evaluation of recurrent UTI. She suffered 4 episodes over the past 9 months and had been hospitalized twice. An ultrasound revealed bilateral hydronephrosis with dilatation of the ureters. So what is the investigation of choice in this condition? So you have to tell a diagnosis. If you know a diagnosis, they have given, I think. It's a case of a bilateral hydronephrosis with dilatation of uterus. So what is the investigation of choice for this child? It's a VCUG, it's a DC DTPA scan, MAC3 scan, or it's a TC DMSS scan. It's an easy one. I'll just repeat for the last time. It's a 2-year-old girl and she was referred for evaluation of a recurrent UTI. So she suffered 4 episodes over the past 9 months and was hospitalized twice. So an ultrasound revealed bilateral hydronephrosis with dilatation of the ureters. So what is the investigation of choice in this child? It's a VCUG. VCUG, that is it's a voiding cystourethrogram. It's voiding cystourethrogram. It's a TC DTPA scan, MAC3 scan, or it's a TC DMSS scan. So if you can just tell the answer here. Anyone wants to answer this? It's the last question for today. Just tell me ABCD also. I will just tell it's good. Okay, the answer is it's A is the right answer. That is the VCUG. That is the voiding vesicourethral. Sorry, it's a voiding cystourethrogram, which is the right answer. Or micturated cystourethrogram. You can just tell that. It's an easy one. MCU. So MCU is the right answer for this. That is the investigation of choice for hydronephrosis. That too in children. See, vesicourethral reflex is basically seen in children. In adults, we don't see a vesicourethral reflex. So whenever a patient comes to you like this and like you think of a vesicourethral reflex, the first investigation you have is mituated cystourethrogram. So DMSA I also thought first, but DMSA is not for that. DMSA is for basically after that. Where I was, it was DMSA should be there here, but yeah. So DMSA is after you get a diagnosis. Because it's not DMSA. DMSA is you after you get the diagnosis, then only you will do a DMSA scan. So yeah, the first investigation of choice we have is VCUG, that is, or MC only, that is the mituated cystourethrogram. So yeah, it's over for today, and yeah, thank you so much for joining, and take care. Good night.